we don't go up and go, that's an emergency, we turn around and leave. We don't do that. So we're the public health. So we're there for the public.
A paramedic says the court ruling upholding the health care plan won't change their standard of care, but he is hopeful it might allow more people to go to a doctor and avoid a trip to the ER. Good evening. I'm Bill Leger. Thank you for joining us. Kelly is off tonight. The U.S. Supreme Court has voted 5-4 to uphold the president's health care plan, including its key element, a mandate that Americans buy health care insurance. Supporters say the law will extend coverage to 30 million of the estimated 50 million who are uninsured. Opponents say it's a case of government going too far. KFDM has a number of reports on the ruling. We begin with Megan Dillard outside an EMS office on Washington Boulevard in Beaumont. Megan?
Bill, first responders leave from this garage. In fact, all units are out on calls as we speak. Sometimes they answer up to 50 calls a day. We spoke with a first responder who is dispatched from this EMS station, and we also talked with the city health director. They believe today's Supreme Court health care ruling could bring relief to more than just patients.
We see just about a little bit of everything.
Beaumont paramedic Robert Falls responds to dozens of calls each day.
A stump toe, or a new mom that don't really know how to, is the baby crying wrong, or, all the way to people that's been shot and stabbed and car wrecks and heart attacks and everything in between.
He'd already responded to about 10 calls when we met up with him today.
Beaumont Fire EMS, the address of your emergency.
Some of those calls come from the Beaumont Fire Dispatch Office. While waiting on more emergencies, he and other first responders watched news of the Supreme Court ruling unfold on TV.
Earlier today, the Supreme Court upheld the constitutionality of the Affordable Care Act.
Within 30 minutes, Falls had to respond to yet another emergency call, this one from Van's Grocery on Avenue A. This 911 call was made from inside a grocery store. Now, the city is not trying to discourage people from calling 911 in an emergency situation, but it hopes that the Supreme Court ruling will allow for more preventative care to lessen the number of 911 calls.
A lot of times it's people who don't have access to see a doctor. They don't have the means to see a physician.
Beaumont Health Director Sherry Ulmer believes the Supreme Court decision will allow city paramedics to focus on more true emergencies.
As this plan rolls out and more people are linked up with a primary care physician, we do hope to see decreases in the calls to 911 that are non-emergency calls.
Something happens, I'll let you know.
A decrease, Robert Falls believes, would allow paramedics to increase their focus, their attention on potentially life-threatening emergencies.
And it would free us up to do, or to be available more often, or have better response times, I guess, to go to the true 911, I just wrecked into a telephone pole, I just got shot kind of things, as opposed to, you're being here on, let's say, somebody with a sore throat.
Again, the city is not discouraging people from calling 911 in an emergency situation, and it's not minimizing what people consider emergencies. The hope is simply that the new health care law will allow people to get preventative care from doctors to free up emergency crews to respond to true emergencies. Reporting live in Beaumont, Megan Dillard, KFDM 6 News.
Tens of millions of Americans, including about 6 million in Texas, don't have health insurance. Some wonder how today's ruling will affect the healthcare industry, especially hospitals. 6 News reporter Callie Desimone is looking into that part of the story. She's in the studio tonight with more. Callie?
Bill, many times people without health care plan end up in the emergency room because they have nowhere else to go. We spoke with an ER doctor at Baptist Hospital about how the ruling might affect emergency care.
All right, Hannah, you ready?
Dr. Jeff Thompson is making his rounds in the emergency department at Baptist Hospital in Beaumont. While they monitor patients, his co-workers are also talking about the Healthcare Reform Act and how it'll affect those in their care.
Physicians everywhere have been following. It's great change. This is the largest change we've seen in healthcare probably in the past 50 years.
A change the White House says will provide insurance for more than 35 million Americans who don't have health care coverage.
You see people at their worst and their sickest.
Thompson says that'll have an impact on healthcare professionals in the ER and beyond.
People currently or before without insurance failed to get the preventative care, failed to get the treatment that they needed. So the ER seemed to be a safety net for a lot of places in the country. We catch the patients who don't have access.
People who may need other preventive testing for life-threatening conditions.
People to have full coverage to get the screenings that they need for prostate cancer, breast cancer, colon cancer.
Dr. Thompson says whether you agree or disagree with the ruling, he believes it will improve access to health care and provide a starting point for a problem that must be handled.
We have something in place, and I think having something in place where we can have trial and error to see if it works.
A step forward or a step backward. Most agree it'll take years before we know whether this healthcare plan will mend what most call a broken system. Dr. Thompson says everyone who steps foot in the ER department gets the same level of care, regardless of whether they have health insurance. Reporting live in the studio, Callie Desimone, KFDM 6 News.
Now, to help pay for the reforms, the plan will impose a tax on the makers of medical devices. Helena Labs in Beaumont has invented and marketed medical devices for decades. It's an international company distributing its products across the world. The devices that come off the assembly line are used by millions of people, including heart patients, children, the elderly, and athletes. The founder, Tipton Goliath, told KFDM News he is concerned about the tax on the makers of medical devices.
People who use our products, costs go up. That's basically medical laboratories, and healthcare costs go up. So it's very negative for us. We are required to basically pay a 2.3% excise tax from every product that we ship out of here to an end user of our products.
Democratic State Representative Joe Desatel says Texas will benefit most from the plan because it has the highest percentage of people without health insurance.
I think in a country as rich as the United States, we should be able to provide health care coverage for our citizens. In the long run, it costs the government a lot less to have healthy citizens and not sick citizens pulling down on our emergency rooms and on our health care system.
Desatel says the law is critical because, among other things, it prevents insurance companies from denying coverage for pre-existing conditions, allows young adults to remain on their parents' plans up to the age of 26, and encourages prevention and wellness. Texas has joined other states in challenging the law in court. Many Republicans, including Governor Rick Perry, say Texas can deliver health care more efficiently and effectively than the federal government. Republican Jefferson County Tax Assessor Collector Shane Howard believes the White House lied to the American people in the way it tried to sell the plan.
People need to ask the president and supporters of the Affordable Care Act, why did you lie to us about what this is and what it is not? You said it wasn't a tax, and yet the only way that it was upheld by the Supreme Court was on the basis of it being a tax.
And the ruling has drawn a large response on our KFDM Facebook page. More than 5,000 people have read our story posted to Facebook, and dozens of you have commented on the ruling. One person wrote, "This has now become the largest tax increase in the history of America." Another comment, "At least people with pre-existing conditions can get health insurance they need." And this, I guess it's just me, but why wouldn't you want health insurance? Has anyone even stepped foot in an emergency room lately? Log on to our KFDM Facebook page to post a comment or to read what others are writing about the Supreme Court ruling. A reminder, stay with KFDM and CBS for continuing coverage of the health care ruling, and go to KFDM.com, where we've posted a number of stories explaining the ruling and offering reaction to it.